A health insurance bill written in 1915 set aside $50 to bury you. Because $50 was what a funeral cost back then. And somebody decided that a health bill had to pay for the burial because they had seen what happens to a family when there's no money for that last bill. I'm sure you've seen it too. And once you know why that line is in there, you will hear the pushback that you get from clients now completely differently. So I want to give you the rest of the list of things that it was covering back then because I think that you're going to be super surprised, but we're going to start from the very beginning. So a group called the American Association for Labor Legislation got started in February of 1906, including economists, lawyers, doctors, and union people, about 3,000 of them altogether. And they spent 9 years on this bill before they published anything because they wanted it built to fit American law and not a copy of Europe. So in 1915, they put out a model bill, and by 1917, they had sponsors in 12 state legislatures. Now, the bill covered 5 things for anybody earning under $1,200 a year, and their family, of course. It covered the doctor, the hospital, the nurse, having a baby for working women, and of course for workers' wives, and $50 for the burial. But then there was a 6th covered benefit. It paid the worker 2/3 of their wage for up to 26 weeks if he or she was too sick to work. Now, when we look at that list, we probably think that all of this are medical bills. But medical bills were the smaller half. A bad illness in a working family in 1915 was a money problem, with a medical problem, a small medical problem, just attached to it. But the doctor really could be paid late, or it could be paid a little bit at a time. It could be paid in chickens, I don't know. But the rent couldn't. So they covered the wages because the wages were what kept the house standing. And that gets me to what this is really about. Before 1906, getting sick in this country was your own problem to solve. So you either saved, you borrowed from family, or maybe the church passed out a plate, or you went without and just hoped. And what that group argued was that the sickness is unpredictable for one person, but very predictable for a larger group of people. So in their mind, a big group can pay for it ahead of time. We call that even now a pool. It's really the idea under every plan that you've ever explained. But even in 1915, people were fighting over whether we should have one or not. Then Teddy Roosevelt ran on this particular concept in 1912 on a platform that asked for a system of social insurance adapted to American use. They already knew that this was going to get attacked, so they even wrote the defense into the sentence itself, but it still didn't work. So what I'd like you to take out of all this stuff I'm telling you right now is really something smaller than the history. When you sit down with somebody and they push back on you, whether it's about the cost of Medicare, like the Part B premium, or the system being broken, or the government being too involved, just know that they sound almost the same as people did 120 years ago, and quite possibly the same as it'll be in the future. And one more thing about those $50. They put a burial benefit inside a health bill because they were trying to catch every single way that a sickness can wreck a family, all the way to the end. And honestly, this should be the exact same thing that you are doing when you put the drug list twice and you run it twice to verify the price, when you verify doctors by calling and checking the system, as well as when you offer a funeral plan, whether it be pre-need or final expense. Now, everything I shared here, to tell you the truth, is something that I went deeper on in my free newsletter on Substack. Like I said, it's completely free, it's weekly, and if I can make a confession, is where I do my best work. You're always welcome to join me there by clicking on the View My Newsletter. But most importantly, I want to know, I'm super curious. Please tell me. When somebody complains heavily about the system with you, what do? Do you typically join them in the complaint? Just to not disagree? Or do you defend the system?